Hi, I'm Dr. Howard Zerka, the doc in Docology. Public health is constantly in the news these days. From new treatments to shifting policies, it can be really hard to separate what's headline grabbing from what really matters for our health. And that's why here on Docology, I want you to hear the science straight from the real experts when a subject of enormous concern suddenly makes the news. And to make that happen, I'll bring on the expert for a quick discussion about what we are hearing or reading in the media. And today we're turning to a topic that focuses on autism. Autism is one of the most studied conditions in neuroscience and medicine, yet it's still surrounded by myths. And over the years, we've heard theories ranging from vaccines to diet, often and usually proven wrong by science, but with lingering dangerous effects in the public's imagination. And now another controversy has surfaced just last week. Could a common everyday medication, acetaminophen, better known as Tylenol, play a role in autism? Millions of people take Tylenol safely every year, including during pregnancy and childhood. But recent headlines have raised questions stirring both scientific curiosity and parental anxiety. Few people are better positioned to help us separate fact from speculation than our guest today, Dr. Helen Tager-Flusberg. She joined me for a long discussion about the science of autism back in April. She's a professor at Boston University, director of their Center for Autism Research, renowned researcher in the field, and she just started the Coalition of Autism Scientists to address the controversies that are out there. So thank you so much for joining me. I thought maybe we could start with, how did this theory about Tylenol and autism even emerge, and what drew the entire scientific community's attention to it?
Well, I think quite a few years ago, people did start to explore all the different kinds of potential environmental factors that may be contributing risk for autism. And that would include things like diet, things like pollution, things like that. And also, most particularly, medications. We've always been concerned about whether medications taken during pregnancy pose a risk to the fetus. And in fact, we know they do. So it's not surprising that people have looked at Tylenol. They looked at it alongside other pain relievers. And the conclusion had been that compared to other kinds of pain relievers, such as aspirin or Advil, in fact, Tylenol is really the safest one to be taking during pregnancy. That said, it's always been with the clear presentation that just take the minimum amount that you need. Don't be sort of taking an excessive amount of Tylenol. And the research shows that there is an association between taking Tylenol and a slight increase in risk for autism. But of course, you have to ask the question, why is a pregnant woman taking Tylenol? And one of the main reasons they're doing that is because they have some sort of an infection. They may be running a low-grade fever. And so they take Tylenol based on the recommendations from their gynecologist, obstetrician.
But could the cause, the infection or whatever they have, be the problem, and the Tylenol is just,
exactly.
So causation, correlation, I guess that's the issue.
So when people have looked at this in a far more careful way, as opposed to a really just let's take one blunt instrument to looking at very complex questions, in fact, that's why women are taking it. And we do have strong evidence that having a fever, inflammation, all kinds of during certain periods of pregnancy are associated with an increased risk. So the conclusion of the scientific community and the medical community has been, take the Tylenol, not for an excessive amount of time, but you're better off taking the Tylenol than allowing the fever and the illness continue. Even if you're just taking Tylenol for pain, which is what many people are doing, again, it's better to take it. You don't want to be suffering from pain because that leads to stress, and stress itself is not a good thing to experience during pregnancy. So that seems to be the story. There may also be some associated risk that's related to how Tylenol interacts with the sort of what we know is a much bigger contributing factor, namely genetics. There may be some factors going on there. So in the best studies that have been done, instead of comparing typical controls, just any other women, they do a sibling comparison. So a woman who had already, one child with autism, but a child without autism, the sibling control paradigm, we do not find an increased risk for autism.
So Sweden did a study looking at twins. Is this that study where they compared looking for environmental factors or what the triggers were?
Yes. So, many of the best studies in this area altogether come out of Sweden, Denmark, Norway. And the reason they do is because the records are simply superb. They have full medical records and can link it to very good environmental record data. And they have it on the whole population, and everyone in the country has good healthcare. So you're also not having to deal with confounding, but some women have far better prenatal care than others. And we do know, again, prenatal care is a really important factor when you want to look at risk for autism or other developmental disabilities.
Right. Thank you on that one. Do you know what's the science when it comes to the neurodevelopment of why would they think Tylenol would do this? Is there something you were mentioning genetics, or do we know any more about that?
I think we don't really have a good handle on all of that. And I would say maybe we ought to be studying other medications where we do know there may be increased risk for autism and worry a little bit less about Tylenol. In those studies, where they try to look at mechanism and they use animal models, they give such huge quantities of the medications to the mice or the rats, and you just really can't tell how much that informs the normal way in which we take those kinds of medications as humans.
You can't extrapolate that because it would be like taking a whole bottle of medicine. And
yeah, I mean, you've got to look at those studies and really have the expertise to interpret them appropriately.
So the expectant mom, what do we tell her? We just say everything in moderation. You don't want to have an infection. You don't want to have inflammation. You don't want to challenge the fetus, but just in moderation.
Yes, just don't take it for longer than you feel that you need to. Once your fever's subsided, try stopping taking the medication.
Perfect. This has been so helpful. And this is what I wanted to address when I do these quick Docology conversations with the experts. Two quick other questions. There was, you started the Coalition of Autism Scientists just recently. Tell us a little bit about the goal and what you've heard from other scientists about that.
Okay, well, it was really quite a spontaneous act on my part. I think I had just appeared on your podcast. It was the week that RFK Jr. appeared at a press conference, spoke in terribly disparaging ways about autism, about autistic people, completely misrepresenting them, having no humanity in the way he spoke about just a very vulnerable segment of our society. And moreover, he completely trashed the science that has been conducted over the last 30 years, saying, dismissing it all and saying he'd have one study, the results of which he'd be able to produce in September, that will tell us everything there is to know about autism, not only what causes it, but what we can do to cure it. And I saw advocacy groups, parent groups, self-advocates responding in very strong and clear ways, trying to correct the record. And I thought, the scientists are missing here. I've been in touch with my friends, my colleagues over email and texting, and I finally thought, we got to do something. And so I called a phone call for a Zoom call, 5 o'clock on a Friday afternoon, and I already drafted a statement that we would release. I had no idea how I was going to get this done, but that's what I did that Friday, because I was just so torn apart by what was happening. So that's how it started.
And I bet you have a lot of scientists. I'm sure you open the floodgates to information from scientists, all who probably are feeling the same way, that they've spent years like you studying this issue.
Yes. We very quickly, and this was not we're not out there recruiting people. We didn't do very much. I mean, I really just sent an email to a bunch of people who came to the top of my head, nothing systematic. And so really by word of mouth, and we have about 300 people, all who are focused on the science of autism. And about 6 weeks in, I formed an executive committee. So everything wasn't just me. I had colleagues who I could run things by. And of course, I picked senior colleagues who had expertise in the different areas of science. And we have the most wonderful PR person who took this on over that weekend. She agreed to do this. She works for us pro bono. Secret is we work on a budget of $0. All right. We are not in the pockets of big pharma. I can tell you that. That's not what this is about. We are just who we are. And, so our goal is we release statements when appropriate. We follow what's going on in the federal government, and we follow what RFK Jr. is doing and saying, responding to that. And the media have been on top of this story all along. Okay. So for the last several months, this has been in the bullseye for the media, and they are turning to us now, when they're looking for scientists to respond, which they always are, because that's where RFK is attacking. He's attacking the science. They come to our group. And so I'm just so grateful that I didn't overthink this, and that I just started something. And I so appreciate all the support I've had from my colleagues.
Well, passion is priceless. So even if you're not getting it's on a zero budget, there's passion has more of a drive than anything else. But you mentioned RFK Jr. He gave a no bid contract, I understand, to RPI, Rensselaer Polytech Institute, to look at a link between vaccines and autism.
Yes.
And I don't know, is this going to just fuel more misinformation? I know we went off the issue of the Tylenol, but will this fuel more misinformation out there?
Well, he managed to keep very quiet about vaccines and autism. He was very upset. He's so obsessed with attacking the entire vaccine system. And he hadn't been mentioning autism, but the last couple of weeks, He's come back to that. I suspect that, so NIH had put out a call for people to come up with proposals to do sort of data mining, looking at causes and service usage for autism. And I think Kennedy was hoping that among the group of awards from that initiative would be a project looking at vaccines. That's something in there. Somebody would submit something on vaccines. Well, my suspicion is there was one application that did. It was not selected for funding. It did not do well in the review process. And I suspect that Kennedy plucked that application. So they've already planned what they want to do, took it from NIH, ported it over to the CDC, one of the other organizations under his remit, and just awarded a no-bid contract. And it's appalling. It's just, the whole process is appalling. The idea is appalling. We know that they received well over 100 applications to this other call for research, and nobody wanted to go there. And the reason people weren't proposing to do this, outstanding studies have been done. We have looked at this question more than any other question in science of autism. And we know that the answer is absolutely no. And with American databases, and this would have been limited pretty much to American data sets, you will not be able to do good science. So we don't know what this project looks like. We have no idea. He talks the good talk about gold standard science. Well, gold standard science means that you publicize what the work is in advance, what the plans are, and so forth. And we know nothing about it. So that's something we're definitely keeping our eye on.
Well, hopefully the coalition, like your new coalition, could address it, because it all is supposed to be peer reviewed. And today, right now, once I get off speaking with you, I'm going to listen to the advisory committee on immunization practices, because we'll see what's going to happen there. And yesterday, the former CDC director testified before Congress about some of these issues. So it's in the news, and it is concerning, because we need to stay focused on the science as we move forward on this issue and every other issue that's out there. So I want to thank you for helping us navigate this complicated and in very many ways emotional space with clarity and balance, because these conversations remind us that science, as I was saying, is always evolving, but we need to do things based on facts, and we need to make sure we move forward on things with the right way, the correct way. So I will continue to follow the Coalition on Autism Scientists, whatever I could find online. And I hope to speak again soon. Is there anything else you want me to be sure that we let our audience hear regarding this issue, or pretty much to
Unfortunately, I don't think it's over.
yes.
I just, every time I think, no, he'll wake up, he'll start to pay attention to what we do know. And what are some of the risk factors that we might be addressing? And I think he'll wake up and he'll start to look at the same things that we do. But sadly, I've been proven wrong so far. And but I'm very committed with my colleagues to be completely on top of this. This is what I'm now spending a great deal of my time on. Somebody has to do it.
Well, thank you for taking this on. You have the expertise, the knowledge, and the dedication, passion to do this. And I think it's so important, because if we do not do this, whether it's on autism or other issues, then the public is going to end up with a disservice. And that's, for all of us who have been committed and dedicated to helping the public, we need to continue to do that. So I thank you very much for this. And just for the audience, remember to see all the podcasts by going to docology.life or onto Substack. And you can also see the podcasts and the conversations I've had on by going to YouTube, Apple, Spotify, or Substack. And don't forget to click like and subscribe. And thank you. Thank you very much for coming on today. And we'll be in touch.
Bye-bye.
Bye-bye. Thanks.